How life changed for you?
Everything changes. Everything.
My son was 6 months when he started looking at his fingers. And I used to find it really cute. Oh, so cute. But then it was too much.
Is my child developmentally okay? Right? So ask for a questionnaire of what are the expected skills, and you make sure to help your doctor understand, are they on track or not?
What I feel lacking, and which I think is really important, parent counseling.
Early intervention. I always keep saying early intervention. It is, for me, the most important part.
If you're going to trust me on this journey, do not go on Google. You need information, you ask me.
Autism or no autism, it does not change my love for them.
It's not over. It's hard. It's not going to be, walk in the park.
So my journey with autism started at a neurodevelopmental pediatrician's clinic. I just went in with questions like they don't have eye contact, they don't respond to their name, they don't point at things, they don't ask for things. And I remember my pediatrician's face. She was like, and right within 5 minutes, she just said to me, I think they are autistic. And that is where it all started. So my first episode, I just wanted it to be basic, clean and clear. And most of us, we started our journeys at a pediatrician's clinic. So I am very lucky, I'm very humbled that I have a pediatrician in the studio with me, Dr. Haneesha. She is a developmental pediatrician. I met her in a conference and I was in awe with her personality. She's humble, she's sweet, and I couldn't have thought of anyone else better than her for my first episode. Thank you, Dr. Haneesha, and welcome.
Thank you, Amreen. My pleasure.
My direct question would be, what are the symptoms that you look in a child when parents bring them to your clinic, telling you that they're delayed? Parents are in denial, like I was. So what do you look at? Like, you listen to the parents, what's the next? What are you looking at when you're looking at a child?
Basically, for us, it's looking at the child as a whole, along with the family that's come in, right? So we are looking at what is that I'm expecting this child to be doing at the age they're coming or walking into the clinic. And this is across milestones. So right from the time the child's walking into the clinic with the mom, you're looking at how's the child walking, what is he doing, is he trying to look at you, is the child anxious, still has a bit of a stranger anxiety, or is he coming in with a smile, trying to play with you? How is the child trying to communicate both with you and with the parent? Because for some of them, we are strangers and they associate our clinic with a vaccination or a blood test. So they are quite scared as well. So giving them that comforting environment to just try and say, hey, we're just here to play, we're just here to chat, trying to understand what are their social skills, how are they communicating with you, what are the emotions that they're going through, are they even finding it difficult to transition, from the outside into the doctor's room, and how are they establishing that rapport with you? That pretty much gives us, I wouldn't say a 100%, but just a snapshot into, what is the child developmentally looking at this point of time.
Okay. Yeah, I remember when I went to the clinic, the second clinic, because, there are doubts in your head and you're like, no, it can't happen with me. The second pediatrician that I went to was in my country, and I emailed him before going, and I said, they are delayed. The moment I entered the clinic, the pediatrician was like, oh, Ahmed, can you take a star? And Ahmed obviously didn't respond, and he was like, they're on the spectrum. And I was like, okay, it's true, they are on the spectrum. So my second guest is somebody who has been an inspiration, who has pushed me for things I thought I'll never do, and this podcast is also a part of that. And she has inspired me. She is a fellow twin mom. She has twins, boys, who are on the autism spectrum as well. And she has a story that could inspire so many of you. So you better check it out. Zahra Jasmiri, welcome. Thank you so much for coming.
Thank you for having me.
And you have a story to tell. I want you to tell people, what's your story? Where did it begin with your twins?
Thank you for having me. I am so proud of you. I've been pushing her. For me, obviously, I was first-time mom, so I didn't have anything to compare to, and I wasn't really. There were no kids, babies, in my family prior to that. So I wasn't really aware that much. But I remember going to a play area, and I would be comparing and seeing, kids their age. And I remember going to their pediatrician and be like, you're a little paranoid, you're too much. Overthinking that twin boys, usually delayed, don't worry about it. And then, of course, the friends and the extended family, everybody's like, no, so-and-so's kid was late, and don't worry about
Examples,
it.
yeah.
Yeah, but I'm like, that's so-and-so's kid, that's not my kid. But I think I had a little gut feeling. And that gut, you kind of ignore that voice, and it just gets louder and louder until you really cannot ignore it anymore. So I think every parent goes through that, that process of denial, angry, depressed. It's a road to acceptance, I call it. So
what were, I'd say, what were the first 4 or 5 symptoms that that rang bell? I remember babycenter.com at the time when, you get pregnant, they tell you your baby's avocado and all, So I was like an avid in that. So that started with me with pregnancy throughout, when they're born. And then I'm checking the milestones, and everything they were checking all their milestones. Everything was fine. They were talking, they were pointing. So I don't know, something happened. God knows what it is. I don't want to get into that, because then, it's another whole debate. But something happens after, because after their, say 12 months, 15 months in this, something changed. Because prior to that, everything was, on the
going on track. So something happened. Let's not get into that. That's a whole nother topic. That's a whole nother podcast. And then, and I went through a lot of pediatricians and doctors. So, and that confused me actually even more, because everyone told me something different, and I went to Abu Dhabi, I went to Al Ain. I was like, whomever I could get an appointment with, I took an appointment with. And and I went even to the States to a neurodisability pediatrician. So that was kind of the journey, how it started.
Okay. Like in my case, your kids had all the milestones on the time. But when I recall my early first 2 years, my twins were delayed on everything. But since, as you said, firstborns, first-time mother, everybody's telling you, no, it's okay, they're twins, they're delayed, you walked so late, you talked so late. But somewhere the gut feeling, I believe mothers, the way they look at their kids, and the voice gets louder. On their first birthday, there was a small incident. I came down, and my father-in-law, he had one of my twins, and my twin had a meltdown. I didn't know at that time, of course. And he was like, look, mommy's here. And I looked at my son, and he was in some other world there. He was just 11 months, and I was like, there's something wrong. There is something wrong. My husband, my mother-in-law, my parents, they're like, you're mad, you're overthinking. And then, Dr. Haneesha, I'll come to you. Pediatricians, most of the times, they also confuse the parents, because as a parent, you are very much emotional. You're keen to know, like, what is it? Why is it? But my pediatrician 2.1, and he's like, are they mumbling? And I was like, no. And then he's like, I think you should see a psychologist, and I think they're on the spectrum. I was like, where were you all these years? So what is this confusion? Because most of the parents that, like you, went to a lot of pediatricians. Why the confusion? Why it can't? I know that official diagnosis is not given until 3. So how do you manage it? Do you tell the parents to wait? Let's give it some time, or it's your speciality as a parent, as a pediatrician. Sorry, you look at a child, and I'm a mother. I look at my child, and I'm like, there's something wrong. So you are a professional. So some pediatricians will tell you to wait. Is that the right approach, or you just tell them, no, there's something wrong?
Yeah, usually in most cases in medicine, as we're taught in general, there's always policy of wait and watch. But I would say in early development, that's not what we follow. The earlier, the better. There's no wait and watch when you know for sure that there is something which is quite divergent or quite delayed, right? So, like you rightly said, the official diagnosis is only after 31 months and above, because that's where we are establishing at least a good neuronal circuit and networking formed. So you do understand what pattern is the brain forming into, or what kind of strengths and challenges the child is building into.
Yeah.
But like you rightly said, with a lot of pediatricians, I would say to some extent it is not very exposed to this condition per se, especially given that the rates or the incidence of this condition is very tremendously increased over the last decade and a half, right? Mm-hmm. So the awareness or the expertise that they carry in understanding this is still a bit lesser than what would be expected. So they still give it some time to see, okay, maybe this is more like a delay, and giving them some time, sending them to school or exposing to a lot more social situations can help them catch up.
Yeah.
But it's very important to give that differentiation. Am I looking at somebody who is not just speaking, let's say a language delay, but communicating? Just like how you play dumb charades.
Yeah.
You are not saying a word, but you have every single way in which you're communicating, eye contact, gestures, social cues, a lot of emotional exchanges is happening. That means there is a language delay, and it's all right to wait up to a certain extent. Close follow-up. Mm-hmm. But if I'm talking about a child who is not communicating, who is in their own world, who's not able to establish an eye contact, respond back to you, engage with you, have that socio-emotional reciprocity, there is no wait and watch. Although we are not right away labeling them, we know these are the early signs, these are the early symptoms. This is the roadmap which we are going to follow. Let's say a child who's 1.5, we know year down the lane, this child will fulfill the diagnostic criteria. Yeah. But we're not going to wait until then to say, hey, look, now you've turned 31 months, you have a diagnosis, let's intervene, because you've lost the golden period in which the brain is developing.
My point,
So the earlier, the better. Even children as young as 6 to 9 months nowadays, we are able to see some very early subtle signs, and we're like, just watch out, start interacting, start socializing, start engaging. Do these as early as you can, because you are working on, like a fresh clay. That's how the brain is. Yeah. So you're trying to mold, you're trying to build these skills. You're not letting this gap of developmental abilities take over the actual potential of the child.
See, my thing here is, like, my son was 6 months when he started looking at his fingers. And, I used to find it really cute. Oh, so cute. But then it was too much. And that is where I started Googling. Google it as best friend. And I could see that it used to say autism, toe walking, not sitting. And I don't know if what's your point of view on that? You say that, they're very young and they can be worked on if there is a little bit delay. But parents like us in this age, we'll just open Google and why is he not doing that? And the doubt is, it's implanted in your head. And then you start looking at ABA and et cetera, et cetera, et cetera, et cetera. And then you fall into that vicious circle of therapies and centers. Maybe your child is just delayed. So this confusion, I don't understand. The importance of diagnosis, Zara, I'll just ask you as well. Mm-hmm. Since you said you went to so many pediatricians, why? And do you think that getting the diagnosis on the paper, yes, your child is on the spectrum, satisfies you internally, because you want somebody to tell you that, okay, yes, your child is on the spectrum? How does getting a diagnosis help you in this journey? And do you actually need an official diagnosis to start the intervention? Because the golden period, you keep going to pediatrician, psychologist, and you just waste that time in denial. Yeah. Because I know it's, I still have goosebumps when I say it, because you don't want to listen to this, that my child is special, is different. Yeah. So do you, or you should wait for a diagnosis?
I'll tell you, for me, I think like with the early intervention is definitely the golden days. It's very tricky because it's parallel with the parent denial era, you know. Yeah. I was lucky that it took me a week, I think, of crying and feeling, and then I was like, oh no, I need to put my big girl pants and get to work, because I knew early intervention needed to happen. And I actually did not get diagnosed when I started. I had to kind of fight with my pediatrician, and I did the hearing test first. I went to rule that out. And they were 2.5 years at the time. And then I kind of begged for speech therapy. Our insurance covered only like $6 a year, but I'm like, okay, let me, because obviously I didn't know about so many other interventions. The first thing you, as a parent, think about speech. And sometimes it's not necessarily the right route to start right away, because some kids have a hard time transitioning and all this, which in my case was. And then so we started with that. And I remember that was the first time I've heard of ABA from the speech therapist at the time, Mr. Daniel, I remember. And
did you know about ABA at that time?
At all, nothing. I knew nothing about it. So no, he told me, and I didn't. I was like, what? And I did completely brush it off. I did not, And then I was like, okay, no. I started going to. I went to different pediatrician because I got confused. Some tell me yes, the other tells me no, they're fine, don't worry about it. Look, they're playing with each other. And I'm like, I don't know. So that was why, looking back now as an OG, I will say don't go to all these, It's like really a cycle that, it's either go to somebody maybe super trusted, that maybe the other moms, but just no, I did that, and that was not very smart and time consuming, wasted time, money, energy, definitely. So I would not recommend going because it just confuses you more. And then actually that time could have been invested in therapy instead.
Then it's also a lot of money involved.
Yes.
Assessments, this.
Yes, a lot.
Yeah.
Yes, absolutely.
Okay, Dr. Haneesha, one more thing that when I look back, I think doctors give the diagnosis, full stop. You need ABA, Applied Behavior Analysis Therapy. For those who don't know, theoretically, it's the authentic way to, proven authentic way to deal with autism. This many hours of ABA, this many hours of occupational therapy, physiotherapy, speech therapy, full stop. The parents leave the clinic and then they fall into depression. And because it's the most difficult thing as a mother that you experience. You cried for a week. I cried for, I think, almost 3-4 months, because for me it was 2. What I feel lacking, and which I think is really important, parent counseling. Because my twins at 2.1, they didn't know that they are on the spectrum. I knew. I looked at my husband, who had a very blank face, and he was like, why are you crying? I was like, do you even know what they're saying? She's saying that your children are special. We didn't know. And it took me a lot of time to consume it. So why we don't, after the diagnosis, why no parent counseling? You need to tell the parent that it's not going to be easy. Get ready for a roller coaster ride. When I went to my own country and the pediatrician over there, he told me one thing, and that just stuck with me forever. He said, Amreen, you're going to get older before time. You'll have fine lines before your fellow moms who have typical kids. But I tell you one thing, don't let it overpower you. Enjoy your children, because they're not going to be children forever. And you will not have this energy, this much bone intensity. You'll grow older. Do not waste time, because you can't undo autism. So what's your take on parent counseling? Why it's not that important?
I would say, again, that from a pediatrician's perspective versus a developmental pediatrician. So I myself worked as a pediatrician for a few years before I specialized into child development. Now, in the pediatrician's clinic, what I see a lot is you're extremely busy because you have a very limited time for each child. So let's say because you're dealing with a lot of acute conditions like fever, cold, cough, or an acute upper respiratory or a lower respiratory infection. So when they look at an entity like this, it more so becomes, okay, I'm making it clear to you that let's say your child has autism and this is the treatment or way forward for you, right? Where I feel it's not that they do not want to have these steps, but unfortunately we become so limited on the timeline, right? But with a developmental pediatrician, for example, if you say the family who comes to me after the extensive investigations or assessments that we go through, and through the journey I make it a point to help the child and the parent to kind of understand what we're going through.
Yeah.
And once we have a feedback session, I spend another 3 or 4 visits with just the parents, because that's what is the key.
Yeah.
Right? You understand what is happening. And for a lot of parents who, let's say, have Googled, they are in a confusion. I've read this, I've read that. Is this what is
Yeah.
true? Does this
A lot of
apply to my child?
questions.
There's another set of parents who are completely unaware. Like, that's the first time they've heard the word from you. So
I'm
they're
one
like,
example.
what is this? Is it, you're trying to tell me this is kind of an infection which will go away with medicine?
Can you
Or are
treat it? Yeah.
Is it something curable? Is it something treatable? So it's important for us as a developmental pediatrician to understand how much is that you are aware about this condition.
Yeah.
On the other hand, there are parents who are well aware of this.
Yes.
You know, either because they've heard this
And some
somewhere,
are
there's
actually
somebody in the
reluctant
family.
as well. They're like, no,
yes,
no,
they are
no,
in
no,
a
no,
denial.
no.
So I feel it's important for us to connect with the parent at that level.
Yeah.
And that's more important for me, even if it means there's a slight delay in starting treatment for your child.
Yeah.
Right? So it's not like, okay, as an emergency, go to the next door, start off therapy. First, you understand. First, because if your cup is empty, you cannot fill in your child's cup as
Yeah,
well.
exactly.
Right? So that becomes very, very important for us. So parent counseling is one of the most key, important core aspects when it comes to management. And what we emphasize, and I strongly believe, is a holistic approach. It cannot be you do therapy, things are going to be fixed. You know, they're going to be inside, you sit outside, cry, and be having 100 questions in your mind is not a solution. And it's not going to help you, because your child's only there for an hour or 2 at the max, but they're with you the remaining 20 hours in a day. So as a parent, what is that I can do? How is that I can help? Now that becomes very important.
Yeah.
So the first step to that, yes, is parent counseling. For you to even understand this condition, step by step.
Yes.
Not all at once.
Yeah.
You can get overwhelmed. Just give them enough to understand, okay, this is what we're going to deal with. Digest this information. We come back, we talk again.
You're
we ask
already
more
overwhelmed
questions.
with the diagnosis.
And Google doesn't help.
Yeah.
So what I also believe in is giving them information which is authentic, which is
Yes.
evidence-based, but just enough for you to understand.
Yeah.
Because you type autism, you can spend years reading what Google says, and you don't know what is true, what is
And
not.
I think as a new
things like
parent,
that.
you're inclined towards the negatives more, because
Yes.
in the beginning, I used to type autism in YouTube and I'll see horrific videos and
Yes.
I'll cry
Yes.
all night.
Yes.
Is it going to be my twins after a few years?
That's one of the first things I tell them. I said, if
Yeah.
you're going to trust me on this journey, do not go on Google. You
Yeah.
need information, you ask me. So
Because
some
there's
parents come
plethora
in
of
and say,
information out there.
yes.
Yeah. Precise,
Okay, I
accurate.
want to know about the causes. Okay, I'm going to give you evidence-based information which you can read. Simple language helps you.
Yeah,
You want to
exactly.
understand what I do as a parent, I'm going to provide you. So giving them that data which is authentic, simple, understandable, not confusing, I think plays a very, very important role, because it realigns your understanding.
I think with autism, it's just behavioral observation. There's no testing. And I don't know if you'll agree, but as a parent, it's more a psychological thing, because you're just being told such a big news based on behavioral observation. You know, usually you'll get tests and there'll be reports and, okay, it's authentic. I did a blood test and it came out. With autism, as a parent, I feel it's more like a psychological war. Like, no, it could be wrong. You could be wrong. He can outgrow of this. And parent counseling is
very important.
Like
and
top
also, yes, and
at the top.
like you said, whenever there are assessments done for their development, or even for autism, like you said, it's not a blood test or an EEG or a MRI scan of the brain. It's
Just
a clinical
observation.
assessment through an expertise that we bring in. So it becomes very important through these assessments, the parents are aware of what we're looking at.
Yeah,
right? Because
exactly.
like you rightly said, it's a 60 or a 90-minute observation using certain standardized tools. And for a parent who's sitting there, it might look like, hey, this doctor just looked at my child for the last
Not
90
easy
minutes.
to digest. Yeah.
And maybe spoke a couple of words, maybe did a couple of things. And how did
My
you
child
just
was in a bad
diagnose?
mood. Oh,
Yes.
I'll come
I
another day.
used to time the pediatricians. I put a timer on. Just
Because you become
so it's
paranoid.
important, I think, as a
To see.
pediatrician who's sitting there assessing, to help the parents understand that, this is what I'm expecting. I
Yeah.
want you also to observe what your child is doing.
Yeah.
So when you rediscuss, it becomes a lot more easier
Yes.
that you say, oh yeah, he does this at home too. So let's say you see a child spinning or flapping or going on the toes. Or maybe sometimes parents are like, oh, I never observed this. Maybe let me observe and get back to you
Get back
and
to
see
you.
if this is happening
So
all
there's
the
a connection
time.
between the doctor and the
Yes,
parent.
it becomes very important
Yeah.
because that's when you are involved. That's when you understand what the doctor is doing. And that's when you take back home and try to observe this, because your eyes see what your mind knows.
Yeah.
And they don't see what your
You
mind
need to
doesn't.
be really
So-
lucky to find the right doctor.
Yeah.
You
I
know,
agree.
you're very lucky if you fall into the right clinic. Zara, once you get the diagnosis, I know because my twins are firstborn as well, so, the motherhood is just completely so different when they're twins.
Yeah.
And it becomes entirely different when those twins are diagnosed with something that's going to stay there. So how did it change for you? How life changed for you?
Everything changes. Everything. Your circle of friends changes. Gets smaller.
Been there.
Everything changes. I think for me, something really wonderful happened though. I remember being. I went through at the end. I wanted to stick to one team through the journey. So I was in Al Jalila Hospital, and I was waiting outside, and I felt like I was the only person with twins diagnosed. I felt so alone. I'm like, oh my gosh, in the pity party. And I remember seeing a mom who had triplets who were on the spectrum, 3 boys. And I was like, that really changed my perspective.
The universe was giving you signs.
Yeah, I was like, oh, wow, I am okay. Literally like looking at the glass half full instead of half empty, right? So I'm like, okay. And you have to, as a parent, change your mindset, because once, happy mommy is happy family, right?
Exactly.
Like it really affects. And I really believe you have to have positive energy and okay, we need a game plan. That's pretty much it. So I'm like, okay, this is what we need to do. I started to do my research, and I put him in a nursery in the beginning, didn't pan out, had to change a few times. And then eventually went and put him in early intervention program, and then I was doing the therapies parallel. And I was that crazy mom, I would say, I can call myself crazy, that, if there is any cancellation, I'm going to take it. I was living, breathing, therapies. I was reading. I was doing in multiple places, going here.
You
and
worked
going,
hard.
Yes. I was going in the center, going in the hospital. If we had any insurance, doing speech or OT, I would go to a governmental hospital. We had limited.
Basically, you didn't give up.
I was doing a lot, so I was always out on the go.
And how was
on the go.
family support and all this, especially your husband, because he shares the journey with you?
With my husband, he's pretty quiet and opposite of me.
It's a good thing.
He really, we were very, I was lucky at least in the fact that he was providing whatever I want to do, whatever I want, the tests I wanted to do, anything. So he was like, okay, do it. But he really let me handle that. We've decided that I'm going to handle this. This is my thing. And then you handle other things.
Teamwork.
Yes, kind of
That's the key.
teamwork. So, so I was lucky in that aspect of, I think for him sharing feelings, the guys, how about, he...
I'm in the same boat. Yeah.
He was just
Shut.
Chill. It looked like it didn't affect him until one time I remember I'm like, you don't share, da, da, da. And he was like, you think it doesn't? Of course it affects me. Of course, it's tough for me. And I was like, oh, wow. He's just chill guy.
I think my husband's just like that. And one day I told him and I said, I cry. I'm so depressed. I've never seen you shed a tear.
Yeah.
You don't love them? You're so emotional in that phase. And he was like, Amreen, I don't care if they have autism or no. They are my kids. I love them. And I will try to provide everything in my capacity. Autism or no autism, it does not change my love for them.
No.
And I think the bond that husband and wife have, it affects this journey a lot.
Oh.
I mean, I am the person who talks and who vents and like bring it on the table and he's like calm. And I lose it on my kids sometimes because it's so difficult. He is calm and he's poised and is like, I don't care. I just want to give them the best life. So sometimes the universe creates the balance between partners and it does favor you.
Yeah.
So Zara, right now, where are your twins and what do you see as an ultimate goal for them? Mainstream schools, jobs, what are they doing right now?
So they're in school. I am trying to, actually, somebody in school asked me, I had a meeting about my kid and she asked me the same question. I told her I want them to be happy. I want my son to be happy.
I know.
That's pretty much it. Simple. I don't really think so much ahead. I'm really trying to focus on the present.
That's the best formula.
Because once, I have trust in God, taking that wheel and I'm just enjoying the ride. It really is that simple. Because
so you live in the present.
I am trying to. It's hard. Of course, we have these things and, but what it creates.
Stress,
anxiety.
yes.
Like, I don't want
one step at a
that.
time.
Yeah.
Makes your hair fall.
If, I know, I'm trying to.
Because this is the one question that all the parents think about every night before going to bed. What if I don't get up tomorrow? And I can't lie about it. You can't get rid of it.
Yeah, and that's
and I totally agree with you. I am a personal believer that you live in the present because it's in your hands. Work hard on them, prepare them for the future, and leave it because future cannot be seen. So you have 2 more boys. They're typical.
Yeah.
What do you think? Has it affected them somehow that they're elder brothers? They're different.
I thought no. But then, of course, that is like when my third was younger, like, oh, I want session too. I want session as well. And I would really put him in session as well, to just leave me alone. And I can have coffee for 2 hours alone and relax. So my youngest is still young. He's in the phase, oh, they're so annoying. He's annoying me,
I know.
But again, we did sibling support once and I put my youngest and oh boy, he had a lot to say. I don't have space in the house.
I know.
It's all about that. So I was like, oh, so it was, and sometimes he says, I have the middle child syndrome, I need attention, and he's a big personality.
Yeah.
But
then it didn't affect them much. But when I look at it, I think you have a role to play in this.
It does. So now, I try to do sometimes. I'm like, hey, you have a doctor's appointment, and I'm like, let's go to Global Village, just me and you. So to do the, but don't tell anybody. It's a secret. Yeah. So you just have to create these moments.
So it's the role of the mother to create that balance.
And then you talked about the future when you don't wake up, right? Yeah. And of course you think about that, but really, as somebody who lost their mom at a young age, again, it teaches you that, it's sad, but people move on.
Yeah. Life doesn't stop.
Life doesn't stop. And I believe that's what's going to happen. If that were to happen, you have to be okay with it. God has...
There's somebody there.
It's going to be okay. You have to believe that. And then, and my husband, before, I took time to get here, okay?
Yeah.
This is a work in progress.
It's a journey. Yeah.
Of course. I was, and I used to cry to my husband, oh my God, if I thought today, what's going to happen to me? The kids, and it's going to be bad. And he used to tell me, when you die, you're not even thinking about no one.
The chapter is closed, the door is shut.
It's you're going to be you're not thinking. And I'm like, no, that's not true. I love my kids. I'm going to think about it. And he's like, no, you're not.
So you only have this life. I read this thing somewhere and it really hit me hard. It was this life is for once. If you are dead, you're dead and you will not be in this again, so enjoy it. And I just want to let everybody know that Zara has a place. It's called Georgetown, which is beautiful. It's helping a lot of parents. It's a rehab center. I'd like you to tell us about that quickly.
Oh gosh, coming from a center hater, I called myself to
Why
managing
did you
one.
open Georgetown?
Actually, it was never my idea. I never wanted to. It toyed around a lot, but actually, two therapists who don't know each other actually, who were a very important part of my kids' journey. Literally messaged me on that same weekend. Hey, you should open your own thing, and and we'd like to join you. And I was like, oh my God, the universe is talking to me. So this is how it all started, and and they're there, and yeah.
And you're helping a lot of parents, and Georgetown is beautiful.
Oh, thank you.
It's colorful, it's vibrant. The moment you enter, your team, your therapists, it's colors, and it's very, the moment I entered, I was like, wow, this is so beautiful. Lilac, indigo, red, pink, blue, it's beautiful. Yeah. So to the last questions to the both of you, Dr. Haneesha, one thing that you'd like to tell to the parents who are scared to, they have another child after their firstborn being on the spectrum, and they observe their child like a hawk, like I did with my third one. What are 3 things that you'd like to tell the parents? These things, if you see this, come to a pediatrician.
Yeah. I think the first and most important thing is when they visit for their vaccines, because they're going to see their pediatrician very often in the first 2 years, especially the first year to year and a half. So I would tell every parent, just like how I'm sure most mothers especially, would be, okay, is my child's weight okay? Do you think he is tall enough? You make sure their growth is okay. Else. So I keep telling them, your third question is going to be, is my child developmentally okay? Right? So ask for a questionnaire of what are the expected skills, and you make sure to help your doctor understand, are they on track or not? Not just physically, like they're crawling, sitting, standing, but are they smiling back, sharing, giggling, mumbling, talking, whatever is expected for their age. Now that is an objective assessment. Like you said, a lot of times confusions exist. Yeah. One doctor says this is okay, one doctor says no, this is not okay, and there's a difference of opinion. That's where the subjectivity comes in. So go objective. That's the reason why we have screening tools, why we have assessment questionnaires. So pick up a standardized screening tool. I would say ASQ, which is the Ages and Stages questionnaire. Extremely simple language, gives you month-on-month milestones. It's a free and downloadable format. So even before you go into your pediatrician, do it yourself. As a parent, just Google for an ages stages questionnaire. Pick up the right age for your child. Just get a printout and see what are the questions. Tick these and go into your pediatrician's chamber and say, just have a look at this and tell me if everything is okay.
And do not wait for the official diagnosis to start the early
If you have a chance, yes. If, let's say, you have a chance to get your diagnosis and just within a couple of weeks you're going to start off intervention, this could help you because it guides you in your overall journey and treatment process. But let's say if this diagnosis itself is going to take you many months or years together, we're not going to wait until then. At least understand from a doctor that, okay, I'm dealing with something which is going towards the risk of autism. I might take time for a diagnosis, but at least let me understand developmentally where my child is and start intervening. And yes, I will relook at diagnosis whenever, that's on cards, that's on track.
Do not wait for early intervention.
Yes, do not wait for early intervention. Yeah. So get at least a clinical correct understanding of your child and start off, right? And like you asked, some of the early signs, I would definitely ask them to look for a social connect. At a young age, is your child looking at you, smiling back, trying to communicate with you, trying to pick up words or pick up word-like approximations around, pick up gestures. How are they engaging? How are they playing with other children? That becomes very important. Especially when children are high functioning, you see that they have language, but this is not functional. We see a lot of children nowadays who come in and parents are like, oh, he has about 100, 200 words. And when you ask them, okay, what kind of words are these? They'll say they're letters, numbers, shapes, colors, solar system, dinosaurs. Yes, but does he just call you and say, Mama, water? No. Mama, park? She says, no, doesn't say Mama, Baba, but says the rest. So that becomes very important. So make sure you're looking at functional communication, engaging with you, participating with you, and any red flag, that becomes very important. So even for us, parental concern is the first and most important thing. Like you said, it's the gut feeling of the parent.
Yeah.
So go to a developmental pediatrician, get this understood thoroughly, and then start your
And move
journey
on.
along.
Yeah. Okay. Fair enough. Zara, one message of hope to all the new parents who are depressed, who are sad, who think life is over and it's going to be all blue.
It's not over. It's hard. It's not going to be, walk in the park. But I'm sure every parent tries to do their best for their kids. So early intervention, I always keep saying early intervention. It is, for me, the most important part. And then learn as a parent, because at the end of the day, they go to a center, they stay, a few hours, but then if you go home and you just leave them on the iPad and there is no structure and, so if the parent is working, have your nanny trained, follow their their sensory diet, what to do,
empower
how to
yourself
transition.
with knowledge.
You have to know, you have to implement. You are with your kid the rest of the 21 hours a day. So definitely learn, teach, and just try to enjoy the ride. There is other beautiful things, and advocate. If you can, there is some people, maybe you can help another mom, join the support groups that we are part of. And, maybe you can have somebody, you see
always
yourself.
connect to the people who are on the same journeys. That
So
helps you the most.
That helps you the most, absolutely.
Yeah. And I think I would just add on one another thing which we spoke about as well, is to take care of themselves. And I think amidst all this, most parents, are just exhausted. Sometimes when they are with us through the journey, they come in, I just look at them and I'm like, when was the last time you took time out for yourself? And they'd be like,
Never.
I have no time. And I said, no, that's not how it works.
You make time.
You have to make time for yourself.
But I think it's a journey. You learn.
Yes,
Initially,
you
in the
learn.
first few years,
Yes.
you're very
Yes.
overworked, you're exhausted, you're emotional. And I think the emotional part, the depression, the sadness, it keeps coming. It's like a submarine. It's not like I'm out of depression. I'm so happy that my child is on the
And if you
spectrum.
need help, take help. That's all right. It's very common that we do see. And also, I'm very happy to hear how both of you have very supportive families. But I would say more than 50% of the times we do see that is not what it is. It's very common to have parental conflicts with children who are neurodivergent or special, and this going on.
But you prioritize.
So take help, prioritize, ask for help, and
Join
create
a
that
support
circle
group.
of care
I
around
think it's
is
important.
very, very important. Yes.
Thank you so much, ladies. This was the first episode of the podcast, and I am so glad that I had you. Thank you so much. You guys are an inspiration. And Zara, I wish you all the best with Georgetown.
Thank you
I
so
hope it
much.
helps as many parents as possible.
Thank you.
And to all the parents who are listening, we sitting here as two mothers with twins on the spectrum is a living proof that life is beautiful and it moves on. Love your children, and just know one thing that I have been saying everywhere since I started advocacy, and it still makes me emotional, that nobody is going to love your child the way you will. And instead of stressing that what's going to happen tomorrow if I don't get up, enjoy these moments that you have, because nobody is going to hug them and kiss them the way you will. And I have goosebumps saying this.
Yes. And give yourself grace.
Yes.
You're not a perfect parent. We are not.
No one
perfect.
is.
No
one is. And they're beautiful. And I'll see you in the next episode. Until then, lots of love and tons of power to you in raising your beautiful angel. Thank you so much.
Thank you.
Thank you. Thank you for having us here.